City Mayor Bill de Blasio is urging Big Apple residents to wear 2 masks instead of 1 to mitigate the spread of COVID-19 as new variants of the coronavirus circulating in the United States are reportedly more contagious. De Blasio's health department has adopted the policy of recommending double masking just days after the Federal Centers for Disease Control and Prevention updated its guidance. We know that even as the vaccine is here, the need to keep wearing a mask is paramount. It's crucial. It's amazing of how all the things that we've learned in this crisis, maybe the most profound is the power of share this article. Share even one of these paper masks makes a huge difference, but what we're saying today is, time to double up. 2 masks are better than 1. Make it a double. The mayor's comments came a day after it was learned that federal buildings in New York said they would start requiring people to wear 2. Chief Judge Colleen McMahon outlined the harsh new COVID measures in a public memo released last. Anyone entering federal court in Manhattan, Westchester County and Dutchess County must follow strict protocols including doubling up. People must also get their temperature checked and answer questions about their health during a screening on it. The policy states that people may either wear a tight-fitting disposable mask under a cloth mask or an FDA-approved KN95 of N95 respirator mask. Anyone wearing a gaiter, bandana or other material to cover their nose and mouth that is not an approved mask will be barred. The CDC updated its guidance, saying people can wear a cloth mask on top of a disposable surgical mask for better fit and extra protection. But the agency stopped short of recommending that Americans wear 2 masks since, if done correctly, the combination of 2 masks can tighten the gaps around the mask's edges that can let virus particles in, the CDC said. The agency also said it will take down the Make Your Own Mask page, which went up last year when masks were in short supply and the CDC was encouraging people to take steps to interrupt virus. Some Americans have already started doubling up. Experts believe that's at least partly out of concern about new strains of coronavirus that have been found to spread more easily than the one that has driven the U.S. epidemic for the past year. CDC guidance has evolved over the course of the mask wearing has long been common in some countries during respiratory outbreaks, especially in parts of Asia, but not in the United States. Last week, U.S. government researchers found that 2 masks are better than 1 in slowing coronavirus spread. The CDC last week reported the results of a lab experiment that spaced 2 artificial heads 6 feet from each other and checked to see how many coronavirus-sized particles spewed by one were inhaled by the other. The researchers found that wearing 1 mask, surgical or cloth, blocked around 40% of the particles coming toward the head. That was when a cloth mask was worn on top of a surgical mask, about 80% when both the exhaling and inhaling heads were double masked, more than 95% of the particles were blocked, said the CDC. John Brooks. When the COVID-19 crisis began and masks disappeared from store shelves, U.S. health officials actively discouraged the general public from wearing them. Seriously, people, stop buying masks. Then Surgeon General Jerome Adams wrote in a tweet almost 2 months later, after it became clear that infected people who did not exhibit symptoms could spread the virus, the CDC began recommending people wear masks in public. Mask wearing increased in some places and forced mask mandates, but many Americans continue not to wear it. A recent University of California survey suggested that only about half of U.S. adults wear masks when in close contact with people outside their house. Discussions about double masking and higher quality masks are important, said Dr. Isaac Bogoch, an infectious diseases scientist at the University of Toronto. But if a significant proportion of your populations isn't wearing a mask in the first place, then they're having the wrong conversation. New York City Health Commissioner Dr. Dave Chokshi said his department's new recommendation is based on the CDC. The single most important thing remains, wearing a face covering consistently and properly so that it covers both your nose and mouth and you wear it both indoors and outdoors. But he added, using 2 masks is more effective at stopping the spread of the virus. People should avoid wearing 2 disposable masks one on top of the other. Instead, they should wear a cloth mask over a disposable mask. 2 of the disposable masks will not improve fit. Chokshi urged those 65 years and older as well as people with underlying health conditions to consider upgrading to a medical standard mask like KN. The mayor on Thursday said that 262 residents of the city were hospitalized with COVID-19 on Wednesday. City health officials reported 3,216 new cases. The rolling 7-day average of the positivity rate stood 17%.